Welcome back to Veterans Health Watch. Some of us love the heat, but for the elderly, it could be a dangerous time of year. Joining us is Dr. Farah Bazorgi, the Medical Director for the Loch Raven VA Community Living and Rehabilitation Center, to tell us more. Dr. Bazorgi, thank you so much for joining us.
You're welcome.
Why do seniors especially need to take precautions during the summer?
Well, the high heat and humidity can worsen the medical conditions. Our bodies have mechanisms to regulate the heat, and unfortunately, as we get older, these mechanisms are not working as well as they should. So most of our elderly persons also have medical chronic conditions. This chronic conditions also impairs the body ability to regulate the heat, and some of the medications that they take for these medical conditions also can affect this mechanism. So overall, they are more prone to heat and to get dehydrated during this high temperatures.
Yeah, we don't realize how important it is for the work that our own bodies do to regulate the heat. So what's the best way for seniors to get through the hot summer months?
It would be best if they can stay inside for the most part. If they have to go out, it would be better to go out during the early hours of the day or the later hours of the day, especially between 10 a.m. and 4 p.m. which the heat is really high. They better stay home with the air conditioning and with the cool temperatures. Or if they have to go out, they can use the public facilities like libraries or in the malls where the air conditioning is provided.
And unfortunately, not every senior has access to air conditioning, and I know some seniors in Baltimore City or in certain areas stay closed in. And what advice would you give a senior who is homebound and doesn't have air conditioning, central air conditioning?
Well, they can use the fans, and they should be in the shaded area. They can use cool baths or showers or drink cool beverages. It will help to keep the body temperature down and prevent from the heat exposure.
Right, especially drinking those cool fluids serves a double purpose, keeping them dehydrated and keeping their body temperatures cool.
Exactly. It's good to drink cool beverages as much as possible. Water is the best drink, and it's good to stay away from alcohol or coffee as they have some diuretic effect and they can help in getting dehydrated. People should not wait until they feel very thirsty, because by then they could be already dehydrated. Okay. So it's better to drink a lot of water as much as they can.
What happens if a person is dehydrated and doesn't act on it?
Usually our body, in order to bring the temperature down, we sweat, and sweating causes this temperature regulation. When we are dehydrated, we don't sweat enough, and this causes us to be prone to the heat stroke.
Okay.
The symptoms for heat stroke could be dizziness, headache, rapid pulse, increased body temperature, and headaches, and at times it can cause even hallucinations. So it's a really dangerous situation, and it's an emergency.
And I know for a regular stroke, you can look for certain signs that a person has, drooping face or hard time with speech. Is that the same for if someone's having a heat stroke? What symptoms should another person look for, maybe in an elderly parent or neighbor, if they're having a heat stroke?
Like I said, the increased body temperature, the flushed face, and the dizziness, the confusion, the headaches, all of these are symptoms that should be looked at.
And what should you do if you see those symptoms or are experiencing those symptoms?
Well, it's an emergency, like I said, the heat stroke, so it's better to call 911. Meanwhile, until the paramedics get there, it's good to take the person into a shaded area. It's better to give them fluids if they're alert enough to drink fluids, try to bring the body temperature down by using the ice packs or cold clothing. And if they're confused or they're vomiting, we should not force them to drink water because it can cause aspiration.
And always call 911
Exactly.
for help.
Exactly.
And we mentioned before, some of our elderly, they tend to shut themselves in. When you reach out for help or ask them for help, they don't always take the help. So we want to look out for our neighbors. What can we do to help our neighbors or our family members who happen to be elderly during the summer months? How can we help them?
We should check on them more frequently. A lot of our elders really, they do not like to bother others, or they might think that it's okay and nothing bad is going to happen. Their assessment of the situation could be wrong. If we have an elderly parent, family, friend, we should check on them more and more frequently. It's good to mention in statistics that was done during 1999 and until 2003. There was like almost 3,500 heat-related deaths. Out of these 3,500, 65% were related directly to the extreme heat that was the cause of the death, and in the rest of them the heat was contributing factor to the death. So it's really important to take the heat very seriously and check more frequently. It would be good if we consider taking them in for the hottest time of the year to have more access to them and monitor them more frequently.
Yeah. Well, Dr. Razorgi, thank you so much for sharing this information with us. We want to keep ourselves and the elderly that we support, we want to keep them healthy during the summer months. So thank you so much for your time.
You're welcome. I'm happy to be here.
Well, we're out of time for today's show, but if you have questions about today's show or would like to make suggestions for future topics, please call us at 1-800-949-1003, extension 5407, or you can visit our webpage at maryland.va.gov. You can also follow us on Facebook or Twitter. And remember, if you are a veteran or you know a veteran who is not using the VA Maryland healthcare system, please stop by one of our facilities across the state. You can visit our webpage at maryland.va.gov, or you can call our enrollment center at 1-800-463-6295, extension 7324. We look forward to serving you. Please join us next time.
The telephone care line is available 24 hours a day, 7 days a week.
If you've got a question about medication, diabetes, your diagnosis, any concerns, you can always give us a call. People want to hear a live voice and not the machine. We're always there to answer your questions. Give us a call.
800-865-2441 and press 1 to speak to a nurse. 24 hours a day, 7 days a week. A nurse is happy to help you.